Dr. Elena Martinez had treated 47 stray animals that week without charging a single penny, while the foreclosure notice on her veterinary clinic's door reminded her that kindness doesn't pay the bills. The 34-year-old veterinarian sat in her empty waiting room at midnight, surrounded by unpaid invoices and medical supply bills that had grown beyond her ability to manage, knowing that tomorrow she would have to choose between saving her business and continuing to help the animals that no one else would treat. What Elena didn't know was that her own beloved dog Buddy, who had been her constant companion through 5 years of building her practice, was hiding symptoms of a serious illness that would require expensive treatment she couldn't afford. And what she couldn't have imagined was that her quiet acts of compassion were about to catch the attention of the most famous entertainer in Las Vegas, who would prove that sometimes angels come in the most unexpected forms. But to understand how Elvis Presley's intervention would transform not just Elena's struggling clinic, but create a model for animal welfare that would inspire communities across the country, you need to know about the promise she made to her dying mentor about never turning away an animal in need. It was November 15, 1975, and Dr. Elena Martinez was facing the mathematical impossibility of running a veterinary practice based on compassion rather than profit. The Foundation's approach addressed multiple levels of the problem simultaneously. At the individual level, it provided immediate financial relief for pet owners who couldn't afford veterinary care. At the professional level, it created sustainable income streams for veterinarians who wanted to serve low-income communities. At the systemic level, it demonstrated that accessible animal care could be economically viable when supported by appropriate funding mechanisms. Dr. Patricia Williams, a veterinary economics researcher at UC Davis, conducted extensive studies of the Foundation's impact over its first 5 years of operation. Her findings, published in the Journal of Veterinary Medical Economics, documented remarkable outcomes that exceeded even Elvis and Elena's initial expectations. What we discovered, Dr. Williams wrote in her comprehensive 1982 report, was that the Foundation model didn't just solve Elena Martinez's individual financial crisis. It created a sustainable ecosystem that improved animal health outcomes, reduced pet abandonment, and strengthened human-animal bonds in underserved communities. The data was compelling. In the 5 years following the Foundation's establishment, pet abandonment rates in Las Vegas dropped by 37%. Emergency veterinary visits decreased by 28% as animals received preventive care that caught problems early. Most significantly, the overall health of pets in participating communities improved dramatically, with vaccination rates increasing by 45% and parasite prevention up by 52%. But the Foundation's impact extended beyond immediate health metrics. Elena's clinic became a training center for veterinary students and recent graduates who wanted to learn how to combine compassionate care with sustainable business practices. More than 200 veterinarians completed training programs at Elena's clinic, carrying the Foundation's model to communities throughout the American West. Dr. James Rodriguez, who had been one of Elena's first trainees, established a similar program in Phoenix that served more than 3,000 animals in its first 2 years of operation. Elena taught us that sustainable charity requires systematic thinking, Dr. Rodriguez explained in a 1983 interview. You can't just treat animals for free and hope everything works out. You need funding mechanisms, referral systems, and community partnerships that make the program viable long-term. The Foundation's success also attracted attention from veterinary schools, which began incorporating Elena's model into their curricula. Students learned not just medical techniques but also approaches to community service that could be maintained throughout a career without leading to financial ruin or professional burnout. Dr. Sarah Chen, who studied under Elena in 1978 and later became head of community veterinary medicine at Colorado State University, credited the Foundation program with shaping her understanding of veterinary ethics. Elena showed us that being a good veterinarian doesn't mean choosing between making money and helping animals, Dr. Chen said. It means creating systems that allow you to do both effectively. The foundation's influence extended beyond veterinary practice into public policy discussions about animal welfare and community health. Elena testified before congressional committees about the relationship between pet access to veterinary care and public health outcomes, arguing that communities with better animal health programs experienced fewer zoonotic disease outbreaks and stronger social cohesion. When families can afford to keep their pets healthy, Elena told the House Subcommittee on Agriculture in 1979, everyone benefits. Healthy pets mean healthier families, stronger communities, and reduced burden on animal control and shelter systems. Elena's testimony contributed to federal legislation that provided funding for community veterinary programs in underserved areas. The Rural and Urban Animal Health Act of 1981 allocated $50 million over 5 years to support veterinary services in communities where traditional practice models weren't economically viable. But perhaps the most meaningful impact of the foundation was measured not in statistics or policy changes, but in individual stories of animals and families whose lives were transformed by accessible veterinary care. Elena's clinic walls became covered with photographs and letters from grateful pet owners who credited the foundation with saving not just their animals' lives but their families' emotional well-being. Maria Santos, whose injured kitten Milagro had been Elena's first charity case in 1973, became one of the foundation's most passionate advocates. By 1980, Maria had learned English, earned her GED, and was working as a veterinary assistant at Elena's clinic while studying to become a veterinary technician. Dr. Martinez didn't just save Milagro, Maria explained during a foundation fundraising event in 1981. She showed my daughter Angela that there are people in the world who care about animals and families like ours. Now Angela wants to become a veterinarian too. That's how change really happens, when people see possibilities they never imagined before. Angela Santos did indeed become a veterinarian, graduating from UC Davis in 1993 with a specialization in shelter medicine. She established mobile veterinary clinics that served rural communities throughout Nevada and California, directly extending the reach of the foundation's model to areas that had never had access to affordable animal care. The ripple effects of Elena's original commitment to never turning away animals in need continued to expand through multiple generations of veterinarians, pet owners, and community leaders who were influenced by the foundation's work. Dr. Michael Johnson, who trained under Elena in the early 1980s, established similar programs in Denver, Seattle, and Portland. His clinics served more than 10,000 animals over 2 decades while training hundreds of veterinary professionals in sustainable community practice models. Elvis continued to support the foundation financially and through personal involvement until his death in 1977. He visited Elena's clinic regularly, often bringing friends and fellow entertainers who were impressed by what they witnessed. Several other celebrities were inspired to establish their own animal welfare foundations, creating a network of support for community veterinary programs across the country. After Elvis's death, Priscilla Presley ensured that his commitment to the foundation continued through his estate. The Elvis Presley Animal Welfare Foundation became one of the largest private funders of community veterinary programs in the United States, eventually supporting clinics in more than 40 states. Elvis understood that true generosity creates systems that outlast the giver, Priscilla Presley said during the foundation's 10th anniversary celebration in 1985. He didn't just want to solve Elena's immediate problem, he wanted to create a model that would help thousands of veterinarians serve their communities without sacrificing their own well-being. The foundation's approach influenced veterinary education throughout the 1980s and 1990s. Veterinary schools began requiring courses in practice management that included modules on serving diverse communities and developing sustainable charity programs. The Association of American Veterinary Medical Colleges adopted Elena's model as a best practice for community engagement, recommending that all veterinary programs include clinical experience in underserved communities. Dr. Elena Martinez herself became a national figure in veterinary medicine, serving on multiple professional boards and advisory committees. She was elected president of the American Veterinary Medical Association in 1987, using her platform to advocate for policies that would make veterinary care more accessible to low-income families. During her presidential address to the AVMA annual convention, Elena reflected on the night that changed her life and the profession she loved. 22 years ago, I sat in my clinic at midnight, surrounded by bills I couldn't pay, and facing the choice between my principles and my survival, Elena told the audience of 3,000 veterinarians. I thought I was alone in that struggle. But what I learned is that individual compassion, when supported by community resources and systematic thinking, can create change that extends far beyond what any of us can accomplish alone. Elena's speech received a standing ovation, but more importantly, it inspired hundreds of veterinarians to develop their own community service programs. The AVMA established the Elena Martinez Award for Community Service, recognizing veterinarians who demonstrated exceptional commitment to serving underserved populations. By 1990, 15 years after Elvis's midnight intervention, more than 300 veterinary clinics across the United States were operating some version of the foundation model. These programs had provided care for more than 200,000 animals whose owners couldn't afford traditional veterinary fees. The success of the foundation model also influenced international animal welfare efforts. Elena traveled to Mexico, Central America, and South America to help establish veterinary programs in communities where pet care had been virtually non-existent. Her work contributed to improved animal health, reduced rabies transmission, and stronger human-animal bonds in dozens of communities throughout Latin America. In 1995, the World Health Organization recognized Elena's contributions to international animal welfare and zoonotic disease prevention. Her work had demonstrated that accessible veterinary care was not just a matter of animal welfare, but a critical component of public health infrastructure. Dr. Martinez proved that caring for animals and caring for human communities are inseparable goals, stated Dr. Hiroshi Nakajima, WHO Director General, during Elena's recognition ceremony. Her model shows that when we invest in animal health, we invest in human health, community stability, and social justice. As Elena approached retirement in the early 2000s, she reflected on the path that had led from that desperate midnight in 1975 to a career that had influenced veterinary practice around the world. The foundation had not only saved her clinic, but had created a legacy that would continue long after she stopped practicing. Buddy, the golden retriever whose illness had symbolized Elena's impossible choices, lived to be 11 years old, enjoying 6 healthy years after his cancer treatment. When Buddy died peacefully in Elena's arms in 1981, Elvis attended the memorial service Elena held at her clinic. Buddy was the reason Elena and I met, Elvis said during the service. His illness helped us understand that individual suffering often points to systematic problems that need systematic solutions. In saving Buddy, we learned how to save thousands of other animals and the families who love them. Elena replaced Buddy with another rescue dog, a mixed breed named Hope, who became the clinic's unofficial therapy dog, providing comfort to worried pet owners and stressed veterinary students. Hope lived to be 14, followed by a succession of rescue dogs who continued the tradition of providing emotional support to everyone who visited the clinic. When Elena finally retired in 2010, her farewell celebration drew more than 500 people, including veterinarians she had trained, pet owners whose animals she had treated, and community leaders whose lives had been touched by the foundation's work. The event raised over $100,000 for the foundation's endowment, ensuring that Elena's model would continue operating indefinitely. Dr. Angela Santos, Maria's daughter who had become the veterinarian she dreamed of being after witnessing Elena save Milagro, was chosen to take over leadership of the Martinez Animal Clinic. Under Angela's direction, the clinic continued to serve as both a community healthcare resource and a training center for the next generation of veterinarians committed to accessible animal care. The clinic's impact by 2010 was measurable not just in numbers of animals treated, but in the transformation of entire neighborhoods. Areas of Las Vegas that had once struggled with high rates of pet abandonment, animal-related disease transmission, and weak human-animal bonds had become communities where pets were valued family members who received regular veterinary care. Dr. Rebecca Thompson, an epidemiologist who studied the Foundation's long-term impact, documented remarkable community health improvements in areas served by Foundation-supported clinics. What we found was that accessible veterinary care created positive feedback loops that strengthened entire communities, Dr. Thompson wrote in her 2012 study. When families could afford to keep their pets healthy, we saw reduced rates of zoonotic disease, stronger social connections, and improved mental health outcomes across all age groups. The Foundation's model had also influenced veterinary business practices beyond community service. Many traditional veterinary practices adopted sliding-scale fee structures, payment plans, and charity care programs inspired by Elena's example. The profession as a whole began to recognize that serving diverse economic communities wasn't just ethically important but could be financially sustainable when properly structured. Dr. Marcus Williams, who established one of the first Foundation-inspired programs in Atlanta, demonstrated that community-focused veterinary practice could be more profitable than traditional models because it created larger patient bases and stronger client loyalty. Elena taught us that when you make veterinary care accessible, you don't lose money. Dr. Williams explained. You gain clients who become advocates for your practice and refer other families who need care. The success of the Foundation model influenced veterinary education reform throughout the 1990s and 2000s. Veterinary schools began requiring students to complete community service rotations, and many established permanent community clinics that served as both training facilities and healthcare resources. The University of Nevada School of Veterinary Medicine, established in 1998, was designed around the Foundation's community service model. Every student was required to complete clinical rotations at Foundation-supported community clinics, and the school's curriculum included extensive training in practice management, community outreach, and sustainable charity programming. We realized that if we wanted veterinarians who could serve all communities, not just affluent ones, we needed to train them differently, explained Dr. Susan Martinez, the school's founding dean and Elena's distant cousin, who had been inspired by Elena's example to pursue veterinary education administration. By 2015, 40 years after Elvis's midnight intervention, the Foundation's influence could be seen in veterinary practices throughout the United States and in several other countries. More than 2,000 veterinarians had completed training programs based on Elena's model, and Foundation-supported clinics were operating in all 50 states. The Foundation's approach had also evolved to address new challenges in animal welfare and community health. Mobile veterinary clinics brought services to rural areas and urban neighborhoods with limited transportation options. Telemedicine programs allowed veterinarians to provide consultations and follow-up care to clients who couldn't easily visit clinics. Partnerships with food banks and social service agencies ensured that families facing economic hardship could access not just veterinary care, but also pet food and supplies. Dr. Jennifer Kim, who directed the Foundation's expansion into Asian American communities in California, developed culturally specific outreach programs that addressed traditional beliefs about animal care while providing modern veterinary services. Elena's original insight was that effective animal care requires understanding the communities you serve. Dr. Kim explained. We've learned that one-size-fits-all approaches don't work. You have to adapt your services to meet communities where they are. The Foundation's work in Latino communities, led by Dr. Carlos Mendez, addressed language barriers, immigration concerns, and cultural attitudes toward pets that sometimes conflicted with standard veterinary recommendations. Dr. Mendez's programs demonstrated that culturally sensitive animal care could improve both animal health outcomes and community trust in veterinary services. Elena showed us that compassionate animal care requires more than medical knowledge, Dr. Mendez said during the Foundation's 40th anniversary celebration. It requires understanding the human context in which animals live, including economic constraints, cultural beliefs, and community dynamics that affect how families relate to their pets. The anniversary celebration, held at the original Martinez Animal Clinic in 2015, drew more than 800 people, including veterinarians from around the world, who had been influenced by Elena's example. Elena, now 74 and officially retired, but still volunteering at the clinic several days per week, reflected on the journey that had begun with her promise to Dr. Chen never to turn away an animal in need. "When I made that promise 42 years ago, I thought it was about me and my individual practice of veterinary medicine," Elena told the assembled crowd. "I never imagined that keeping one promise would create a movement that would influence how thousands of veterinarians practice and how hundreds of thousands of animals receive care." Elena's speech was interrupted several times by standing ovations from veterinarians whose careers had been shaped by her example, and from pet owners whose families had been touched by foundation-supported care. Dr. Robert Chen, Dr. William Chen's son, who had become a veterinary educator at UC Davis, spoke about the ongoing relevance of his father's teachings and Elena's example. "My father believed that veterinary medicine was a calling that required service to all animals, not just those whose owners could afford premium care," Dr. Chen said. Elena Martinez proved that such a calling could be both sustainable and transformative, not just for individual practitioners but for entire communities. The celebration also featured presentations by researchers who had studied the foundation's impact over 4 decades. The data they presented documented extraordinary achievements: more than 500,000 animals treated through foundation-supported programs, more than 2,000 veterinarians trained in community service models, and measurable improvements in animal welfare and community health in hundreds of neighborhoods across the United States and several other countries. But perhaps the most moving moment of the celebration came when Maria Santos, now 68, and working as the clinic's community outreach coordinator, introduced her granddaughter Sophia, who had just been accepted to veterinary school at UC Davis. 52 years ago, Dr. Martinez saved a little kitten named Milagro, Maria said, her voice filled with emotion. "That miracle led to my daughter Angela becoming a veterinarian, and now to my granddaughter Sophia following the same path." That's how Elena's promise to never turn away an animal in need has created miracles in 3 generations of our family. Sophia Santos, representing the 3rd generation of her family to be influenced by Elena's compassionate approach to veterinary medicine, spoke about her plans to specialize in zoo and wildlife medicine, extending the foundation's model to conservation and wildlife rehabilitation programs. "Dr. Martinez taught us that veterinary medicine is about more than treating individual animals," Sophia said. "It's about understanding the connections between animal health, human health, and community well-being. I want to apply those same principles to helping wildlife populations and protecting biodiversity." The Foundation's influence on wildlife conservation had indeed become significant by 2015. Patricia Rodriguez, who had trained under Elena in the 1980s, had established wildlife rehabilitation programs that applied Foundation principles to caring for injured native animals. Her programs, operating in national parks and wildlife refuges throughout the Southwest, had treated more than 30,000 wild animals while training conservation biologists in veterinary techniques. As Elena looked around the crowded clinic during the anniversary celebration, she could see evidence everywhere of how far the Foundation's influence had spread. The walls were covered with photographs of animals whose lives had been saved, letters from grateful families, and certificates recognizing the achievements of veterinarians who had carried the Foundation's mission to communities around the world. But Elena's greatest satisfaction came from knowing that the model she and Elvis had developed would continue long after she was gone. The Foundation had become institutionalized within veterinary education and professional practice in ways that made its principles self-sustaining and continuously evolving. Dr. Angela Santos, now the clinic's senior veterinarian, and Elena's designated successor, had already begun planning the next phase of the foundation's evolution. New initiatives included mental health support for veterinarians dealing with the emotional challenges of animal care, disaster response programs that could provide emergency veterinary services during natural disasters, and international development programs that would establish veterinary training centers in underserved regions around the world. Elena and Elvis created something that was bigger than both of them. Dr. Santos reflected during a quiet moment after the anniversary celebration. They showed us that individual acts of compassion, when supported by systematic thinking and adequate resources, can create lasting change that touches thousands of lives across multiple generations. The story of Elena Martinez and Elvis Presley had become more than just an inspiring anecdote about a veterinarian who was saved from financial ruin by a generous celebrity. It had become a demonstration of how personal values, when supported by community resources and strategic planning, could transform entire systems and create sustainable solutions to complex social problems. As Elena finally locked up the clinic that night in 2015, 40 years after the midnight encounter that had changed her life, she reflected on the promise she had made to Dr. Chen and how keeping that promise had led to outcomes she could never have imagined. The frightened, financially desperate veterinarian who had sat surrounded by unpaid bills in 1975 had become a leader whose influence extended far beyond her individual practice. Today, the Martinez Animal Clinic continues to serve the Las Vegas community while training new generations of veterinarians in the principles Elena and Elvis established. The walls of the clinic display a timeline of the foundation's growth and impact, but the most prominent display is a simple plaque that captures the essence of what they accomplished together. Elena Martinez and Elvis Presley proved that compassion without sustainability is just martyrdom, but compassion with systematic support can change the world. Their partnership demonstrated that individual sacrifice, when supported by community resources, becomes individual strength that serves entire communities. The legacy continues through the thousands of veterinarians who learned that serving all animals, not just those whose owners could afford premium care, was not only ethically right but practically possible. Their work reminds us that the most powerful changes often begin with individuals who refuse to accept that impossible choices are really impossible, and who find ways to transform personal struggles into community solutions that last for generations. Dr. Elena Martinez had treated 47 stray animals that week without charging a single penny, while the foreclosure notice on her veterinary clinic's door reminded her that kindness doesn't pay the bills. The 34-year-old veterinarian sat in her empty waiting room at midnight, surrounded by unpaid invoices and medical supply bills that had grown beyond her ability to manage, knowing that tomorrow she would have to choose between saving her business and continuing to help the animals that no one else would treat. What Elena didn't know was that her own beloved dog, Buddy, who had been her constant companion through 5 years of building her practice, was hiding symptoms of a serious illness that would require expensive treatment she couldn't afford. And what she couldn't have imagined was that her quiet acts of compassion were about to catch the attention of the most famous entertainer in Las Vegas, who would prove that sometimes angels come in the most unexpected forms. But to understand how Elvis Presley's intervention would transform not just Elena's struggling clinic, but create a model for animal welfare that would inspire communities across the country, you need to know about the promise she made to her dying mentor about never turning away an animal in need. It was November 15, 1975, and Dr. Elena Martinez was facing the mathematical impossibility of running a veterinary practice based on compassion rather than profit. The numbers on her desk told a story that couldn't continue much longer. 47 animals treated for free in the past week, 32 unpaid invoices from the previous month, and a bank balance that had been negative for 6 days running. Elena had never intended to become Las Vegas's unofficial charity veterinarian. When she opened Martinez Animal Clinic 3 years earlier, fresh out of veterinary school at UC Davis, she had planned to build a sustainable practice serving the growing suburban communities around Las Vegas. She had solid business training, reasonable startup capital from her savings and a small loan, and a location in a strip mall that put her clinic within reach of middle-class families who could afford quality pet care. But Elena's transformation from business-minded veterinarian to financial martyr had begun with a single case that had walked through her door on a rainy Thursday evening in January 1973. Maria Santos, a hotel housekeeper who spoke limited English, had carried in her daughter's injured kitten wrapped in a blood-stained towel. The cat had been hit by a car and needed immediate surgery to survive. "Please, doctora," Maria had said, tears streaming down her face as her 8-year-old daughter Angela clutched her sleeve. "Is all we have. Angela loves so much this cat." Elena had examined the kitten and found internal injuries that would require several hours of surgery and post-operative care, costing approximately $400. Maria pulled out a crumpled envelope containing $63 in cash and food stamps. "Is all I have," Maria said again. "Please, for Angela." Elena looked at the little girl whose dark eyes were wide with fear and hope, then at the injured kitten who was still fighting to live despite his injuries. In that moment, she made a choice that would define the rest of her career. "Don't worry about the money," Elena had said. "Let's save this cat." The surgery took 5 hours. The kitten, whom Angela named Milagro, made a full recovery, and Elena discovered something about herself that she hadn't learned in veterinary school. The satisfaction of saving an animal's life was worth more to her than any fee. Word spread quickly through Las Vegas's working-class immigrant communities about the veterinarian who wouldn't turn away animals because their owners couldn't pay. Elena found herself treating pets for families who cleaned hotels, worked in restaurant kitchens, and did landscaping for wealthy neighborhoods while living in apartments that barely allowed pets at all. Each case presented the same impossible math: animals who needed care, owners who had love but no money, and Elena's growing inability to reconcile her business needs with her sense of purpose as a healer. The situation was complicated by Elena's own background. Her parents, Roberto and Carmen Martinez, had immigrated from El Salvador when Elena was 10 years old. Roberto worked construction while Carmen cleaned houses, and both had sacrificed enormously to ensure their daughter could attend college and veterinary school. Elena understood intimately what it meant to work multiple jobs while struggling to afford basic necessities, and she couldn't bring herself to deny veterinary care to families who reminded her of her own. "Mija, you have a good heart, but you need to eat too." Her mother Carmen had warned during one of their weekly phone calls, "You can't save every animal if you don't save yourself first." But Elena couldn't see a way to balance her financial survival with her commitment to helping animals whose owners couldn't afford traditional veterinary fees. Every time she considered implementing strict payment policies, another desperate pet owner would appear with an injured animal and a heartbreaking story. By November 1975, Elena's compassionate approach to veterinary medicine had created an impossible situation. Her clinic had become the go-to destination for pet emergencies among Las Vegas's working poor, but her growing reputation for free care had made it financially unsustainable. The foreclosure notice had appeared on her clinic's door that morning, taped there by a bank representative who had avoided eye contact as he explained that Elena had 30 days to bring her mortgage payments current or lose the property. Elena owed $14,000 in back payments, late fees, and penalties, a sum that might as well have been $14 million given her current financial situation. Elena's medical supply distributors had already placed her on credit hold, meaning she could only purchase medications and equipment with cash she didn't have. Her malpractice insurance was 3 months overdue, and her veterinary license renewal fee would be due in 6 weeks. Another expense she couldn't cover. But the crisis Elena was struggling with wasn't just professional, it was deeply personal. Her constant companion through the stress and uncertainty of building her practice had been Buddy, a 5-year-old golden retriever she had rescued as a puppy from an abusive situation. Buddy had been by her side through every long day and sleepless night of establishing her clinic, offering the unconditional love and emotional support that had kept Elena going when everything else seemed impossible. Over the past 3 weeks, Elena had noticed changes in Buddy that her trained eye couldn't ignore. He was sleeping more, eating less, and moving with the careful deliberation of an animal in pain. When she palpated his abdomen, she could feel an enlargement that suggested a serious problem requiring immediate diagnostic testing and likely expensive treatment. Elena knew she should take Buddy to a specialist for ultrasound, blood work, and biopsy procedures that would cost at least $800. But Elena didn't have $800. She had spent her last available cash on antibiotics for a litter of puppies, brought in by a family who had found them abandoned in a park. The irony was devastating. Elena, who had dedicated her career to animal health, couldn't afford proper medical care for her own beloved pet. She was asking Buddy to wait for treatment while she provided immediate care for other people's animals. "I'm sorry, Buddy," Elena whispered to her dog as she sat in her clinic that November evening, surrounded by bills she couldn't pay and medical equipment she might lose. "I know you're not feeling well. I know you need help, but I don't know how to help you without stopping help for everyone else." Buddy looked up at Elena with the patient, forgiving expression that dogs somehow maintain even when they're suffering. He walked slowly to his bed in the corner of her office and lay down with a soft sigh that broke Elena's heart. Elena had reached the point where she would have to make an impossible choice: close her practice and get a job at an established veterinary hospital where she could earn steady money but would have to turn away animals whose owners couldn't pay, or continue operating her compassionate but financially unsustainable clinic until the bank took it away and she lost everything. That night, as Elena sat calculating exactly how broke she was, she thought about the promise she had made to Dr. William Chen, her mentor during veterinary school. Dr. Chen had been a professor of veterinary ethics who taught students that their profession was about more than medical technique. Elena, Dr. Chen had told her during their last conversation before his death from cancer, "You have a gift for seeing animals not as business opportunities, but as patients who deserve care regardless of their owner's economic circumstances. Promise me you'll never let the business of veterinary medicine make you forget the calling of healing." Elena had promised, never imagining that keeping that promise would require choosing between her financial survival and her professional integrity. What Elena didn't know was that her reputation for selfless animal care had begun to reach beyond the immigrant communities she primarily served. Other veterinarians in Las Vegas had begun referring clients to Elena when they encountered pet owners who couldn't afford necessary treatments. Animal rescue organizations had started bringing injured strays to her clinic because they knew she wouldn't turn them away. Elena's phone rang constantly with requests for help from people who had heard about the veterinarian who would treat animals for free. She had become a one-person safety net for pets whose owners fell through the gaps in Las Vegas's veterinary care system. But Elena's growing reputation had also attracted the attention of someone who understood what it meant to give everything to others while forgetting to take care of yourself. Elvis Presley had been driving through Las Vegas neighborhoods on one of his late-night excursions when he noticed lights still on at Martinez Animal Clinic, well past midnight. Elvis had always been drawn to stories of people who sacrificed their own interests to help others. His own generosity was legendary among his friends and staff, but he was also aware that his wealth made it easy for him to be generous without real sacrifice. Elena's situation represented something different, a person giving beyond her means, risking her own survival to help others. On that November night, as Elena sat in her clinic, trying to figure out how to keep her promise to Dr. Chen without losing everything she had worked for, Elvis was parked across the street, watching lights in the clinic windows and wondering what kind of emergency would keep a veterinarian working so late. Elvis had been dealing with his own struggles with purpose and meaning. Despite his enormous success, he often felt disconnected from the impact of his work on individual people's lives. He performed for thousands of fans, but he rarely had the opportunity to see direct results of his efforts to help others. Seeing the lights in Elena's clinic sparked Elvis's curiosity about the person inside who was working while the rest of Las Vegas slept. He decided to investigate, not knowing that his simple act of checking on a late-night worker would transform both their lives. Elvis parked his Cadillac and walked to the clinic's front door, where he could see Elena through the window, surrounded by paperwork and clearly struggling with some kind of serious problem. He knocked gently on the glass door, not wanting to startle her. Elena looked up, surprised to see anyone outside her clinic at this hour. When she recognized Elvis Presley standing at her door, she assumed she must be hallucinating from stress and exhaustion. "Excuse me, ma'am," Elvis called through the glass. "I saw your lights on and wanted to make sure everything was all right. It's pretty late for a business to be open." Elena unlocked the door, still not quite believing that Elvis Presley was standing outside her failing veterinary clinic. "Mr. Presley," Elena said uncertainly, "is there something I can help you with? Do you have a pet emergency?" "No emergency," Elvis replied. "I was just driving by and noticed you were still working. I wanted to check if you needed any help." Elena looked at Elvis, trying to process why the most famous entertainer in Las Vegas would be concerned about her late-night work schedule. "That's very kind, but I'm fine," Elena said automatically, then immediately realized how unconvincing she must sound given her obvious stress and the foreclosure notice taped to her door. Elvis's eyes moved to the foreclosure notice, then back to Elena's face, which showed the exhaustion and worry of someone facing impossible circumstances. "Mind if I ask what kind of veterinary work keeps you here so late?" Elvis said. Elena hesitated, uncertain how to explain her situation to someone who probably couldn't imagine financial problems. "I've been treating some animals that needed emergency care," Elena said carefully. "Sometimes that means working unusual hours." "And the foreclosure notice?" Elvis asked gently. "That seems like it might be causing some stress." Elena felt tears starting to form, partly from exhaustion and partly from the unexpected kindness of a stranger asking about her problems. "I'm having some financial difficulties with the practice," Elena admitted. "I've been treating animals for families who can't afford veterinary care, and that's made it hard to keep up with my business expenses." Elvis nodded thoughtfully. He had encountered many people over the years who had made career choices based on helping others rather than maximizing their income. "How many animals are we talking about?" Elvis asked. "This week, 47, Elena said. "But that's unusually high. Usually it's more like 20 or 30 per week." Elvis was quiet for a moment, processing the mathematics of Elena's situation. 47 animals treated for free in 1 week represented thousands of dollars in unpaid veterinary services. "And you're doing this because?" Elvis asked, not in judgment but in genuine curiosity about Elena's motivation. "Because they need help," Elena said simply. "And because I promised my mentor that I would never turn away an animal that needed care." Elvis understood promises to mentors. His own relationship with his mother had created commitments that influenced every major decision in his life. "Can I ask you something personal?" Elvis said. "How are you taking care of yourself while you're taking care of all these animals?" Elena looked at Buddy, who was lying in his bed in the corner, clearly not feeling well. "That's the problem," Elena admitted. "I'm not. My own dog is sick, and I can't afford to treat him properly because I've spent all my money treating other people's pets." Elvis followed Elena's gaze to Buddy, and immediately understood the heartbreaking irony of Elena's situation. "What's wrong with him?" Elvis asked, walking over to where Buddy was lying. "I think he might have cancer," Elena said, her voice breaking. "He needs diagnostic tests that cost more than I have. I've been hoping I'm wrong, but the signs are getting worse." Elvis knelt down beside Buddy, who lifted his head slightly to acknowledge the visitor but clearly didn't have much energy. "How long has he been like this?" Elvis asked. "About 3 weeks," Elena said. "It started gradually, but he's been declining faster the past few days." Elvis looked at Elena, seeing the pain of a veterinarian who could diagnose her dog's illness but couldn't afford to treat it. "Elena," Elvis said, using her name for the first time, "what would it cost to get Buddy the treatment he needs?" "Maybe $800 for the diagnostic work," Elena said. "Depending on what we find, treatment could be anywhere from hundreds to thousands more." Elvis was quiet for a moment, thinking about Elena's impossible situation. Here was a person who had given so much to help others that she couldn't help herself, even when her own beloved pet was suffering. "And what about your clinic?" Elvis asked. What would it take to solve the foreclosure problem? $14,000, Elena said. Plus I'd need working capital to buy medical supplies and catch up on other bills. Probably $20,000 total to get back on solid ground. Elvis nodded, doing calculations in his head. $20,000 was more money than Elena could imagine having, but it was less than Elvis spent on stage costumes in a typical month. Elena, Elvis said, I want to help you, but I want to do it in a way that solves the real problem, not just the immediate crisis. Elena looked at Elvis with confusion. Why would a celebrity want to help a struggling veterinarian he had just met? I don't understand, Elena said. Why would you want to help me? Because what you're doing matters, Elvis said. You're using your skills to help animals and families who can't get help anywhere else. That's important work, and it deserves support. Elvis paused, looking around the clinic at the medical equipment and supplies that represented Elena's commitment to animal care. But I think the real problem isn't just money, Elvis continued. The real problem is that you're trying to run a charity disguised as a business. That's not sustainable, no matter how much financial help you get. Elena realized that Elvis understood her situation better than she had expected. What are you suggesting? Elena asked. I'm suggesting that we figure out a way to make your approach to veterinary medicine sustainable, Elvis said. Not just for you, but as a model that could help other veterinarians who want to serve families that can't afford traditional pet care. Over the following hour, as Buddy slept peacefully in his corner, and Elena's clinic remained illuminated in the midnight darkness, Elvis and Elena developed a plan that would transform not just her practice, but the entire approach to affordable veterinary care in Las Vegas. Elvis's proposal was comprehensive and innovative. He would establish the Presley Animal Welfare Foundation, with Elena as its director of veterinary services. The foundation would cover the costs of treating animals for low-income families, allowing Elena to provide compassionate care without destroying her financial stability. But Elvis's plan went beyond just solving Elena's immediate problems. He wanted to create a replicable model that could be implemented by other veterinarians in other cities, demonstrating that compassionate animal care could be both ethically satisfying and economically viable. Elena, Elvis said, what you've been doing for the past 3 years proves that there's a huge need for affordable veterinary care in communities like this, but you've also proven that individual veterinarians can't meet that need alone. We need a system that supports vets who want to serve everyone, not just people who can afford full-price care. Elena listened to Elvis's proposal with growing amazement. Not only was he offering to save her clinic and pay for Buddy's treatment, but he was proposing to turn her personal struggle into a solution for similar problems faced by veterinarians and pet owners throughout the country. Why are you doing this? Elena asked again, still not quite believing that her desperate situation had attracted this level of attention and support. Because I've learned that the best way to use success is to help other people achieve their own success, Elvis replied. You've already proven that you can provide excellent veterinary care to animals that need it most. I want to make sure you can keep doing that without having to choose between helping animals and paying your bills. The foundation Elvis proposed would work through a simple but effective mechanism. Pet owners who couldn't afford full veterinary fees would be referred to participating veterinarians who would provide care at reduced rates. The foundation would subsidize the difference, ensuring that veterinarians could maintain viable practices while serving clients regardless of their ability to pay. Elena would become the foundation's model practitioner, demonstrating how the program worked and training other veterinarians who wanted to participate. Her clinic would serve as a prototype for compassionate, financially sustainable veterinary care. But first, Elvis said, looking at Buddy, we need to get this guy the treatment he needs. Can we take him to an emergency clinic tonight, or should we wait until morning? Elena looked at Buddy, who seemed to be resting peacefully for the first time in weeks. Morning should be fine, Elena said. The emergency clinic here isn't equipped for the diagnostic work he needs anyway. I'll call Dr. Rodriguez at the specialty clinic first thing in the morning. Good, Elvis said. And I'll have my accountant work out the details of paying off your clinic debts and setting up the foundation. This time next month, you should be able to focus on veterinary medicine instead of financial survival." As Elvis prepared to leave Elena's clinic that night, he turned back to ask one more question. "Elena, that promise you made to your mentor about never turning away an animal in need, do you still believe that's the right approach?" Elena thought about Dr. Chen's words and about the 47 animals she had treated that week, including several who probably wouldn't have survived without immediate care. "Yes," Elena said. "I believe that's why I became a veterinarian. Not to get rich, but to heal animals that need healing." "Then we're going to make sure you can keep that promise," Elvis said, "without having to sacrifice your own dog or your own future to do it." Within a month of that midnight conversation, Elena's entire professional life had been transformed. The Presley Animal Welfare Foundation had paid off her clinic debts, restocked her medical supplies, and established a sustainable funding mechanism for treating animals belonging to low-income families. Buddy's diagnostic tests revealed treatable cancer that responded well to surgery and chemotherapy that the foundation covered completely. Elena's beloved companion made a full recovery and lived 6 more healthy, active years. But the most significant change was in Elena's daily practice of veterinary medicine. Instead of agonizing over whether she could afford to treat animals whose owners couldn't pay, Elena could focus entirely on providing the best possible medical care. The foundation's support meant that Elena could say yes to every animal that needed help without worrying about financial consequences. The model developed by Elvis and Elena proved highly successful and attracted attention from veterinarians, animal welfare organizations, and public health officials across the country. Within 5 years, similar programs were operating in more than 20 cities, providing affordable veterinary care to thousands of animals whose owners otherwise wouldn't have been able to afford treatment. Elena became a national spokesperson for accessible veterinary care, speaking at conferences and training other veterinarians who wanted to participate in foundation-supported programs. Her story became a powerful example of how individual compassion, when supported by adequate resources, could create systematic change that benefited entire communities. But for Elena, the most meaningful change was personal. She had learned that keeping her promise to Dr. Chen didn't require sacrificing her own well-being or her relationship with Buddy. With proper support, she could be both compassionate and sustainable, both generous and self-caring. Years later, when veterinary students asked Elena about the night that changed her life, she would emphasize that Elvis's intervention had been important not just because of the financial support, but because of his understanding that sustainable charity requires systematic solutions rather than individual martyrdom. "Elvis taught me that helping others doesn't mean destroying yourself," Elena would explain. "It means creating systems that make helping others sustainable and replicable. The goal isn't to be a hero who burns out after a few years. The goal is to create lasting change that continues long after you're gone." The Presley Animal Welfare Foundation continued operating for decades after Elvis's death, eventually expanding to serve communities throughout the American West. The foundation's model influenced veterinary education programs, animal welfare policy, and the development of community-supported veterinary practices that made pet care accessible to families regardless of their economic circumstances.